get to play. Take the dog.
Or your
take
cat.
a husband. Take a child.
Yeah. These are the cups. Well, they're pods. So they're a little bit easier to handle, put on and off. But they're pretty sticky. You leave them on there for long enough.
Yeah, I bought some from Aldi.
Okay.
Yeah,
Great.
I saw that. Aldi ones.
Aldi brand.
Yeah.
Yeah. Okay.
I got quite a few things from Amazon.
Yeah. Okay.
And a little bit too much, and it's a bit tight. But
Okay.
yeah, I got
There
a
you
different
go.
cupping though.
That.
Oh, that's a good one.
Yeah. So they've been awesome. I've been doing them on some clients.
Yeah.
Yeah. Right. Get on from
Next
there.
time I might get
Neither did I until I saw them on my first.
Yeah. So. So we do bigger ones of these as well.
Yeah.
So they're those, so you already know about them. Again, for a knee treatment, I would massage, and then I'll put a couple of cups around the knee, and then I'd work on this leg or whatever, and then I'd take them off, work a bit more, put cups on that one, and then tape them.
Then tape it. Yeah. Cool.
Yeah.
Is there, like, for people, I've got a couple of clients that suffer from migraines and headaches.
Yeah.
Just out of curiosity. Like, I don't think RockTape could do anything, but is it something that, like, can be any good?
Depends.
Like, with maybe doing it here? I don't know.
You could try it. Yeah, you could just say, if it doesn't make them worse, and if it feels good, then you can only try it.
Yeah.
Again, you're applying the technique with a thesis that it might help.
Yeah.
And you can put pieces down here as well, if it's sort of tension related.
Yeah.
But even that kind of stimulus may take the focus away from what's going on in the head. So it may.
This one particular client I'm thinking about, I mean, she has so much Botox.
Yeah.
For migraines.
Yeah, I've got quite a lot of clients like that.
So I'm there going, but would she even, if you're having that much Botox, I don't know, again, I'm just like, what else could I do for her?
Yeah.
RockTape, would RockTape do
Yeah,
that?
I mean, you could just put a strip across the back there and just put one strip and see how she responds. So you just put it like literally just a piece that goes from there to there.
Okay.
Just put it across the neck like that.
Okay.
And just see if that.
So do the massage, wipe it off, put it and just tell her like.
Yeah, you can take it off. Totally your control. If it noise, you take it off.
Yeah.
If it makes things worse, take it off. So it's always in the patient. Always in the patient's control.
I know the one of a client. I goes to aged care the people.
Yeah.
Most of them are not enough water.
Yes.
Not enough water, yeah.
And then one of the lady keeps saying, drink more water, bits by bits, and sip and the things. And she recently stopped drinking more water because new bottle from the sun. Anyway, she said about 2 weeks after, and then she say, I don't hear clicking noise. Used to hear on the neck.
Yeah, right.
And amazing, 2 weeks.
Yeah.
And then I could
Hydration.
feel clicking thing.
Yeah.
If I think maybe I'm pretty sure it's much less than I used to be.
Yeah.
She probably need more and more, but water actually is very important.
The problem with elderly people, of course, is the more they drink, the more they've got to go to the toilet.
Yes, that's right.
That's of mobility, and so they want to avoid that as well.
And then some people got problem for kidney or whatever. It's doctor who tell the client, limited the water. Yeah. And just the
But
sometimes
surely,
question.
even, no matter our age, even though we drink water, it's still filling our cells, how we rehydrate. Is far more important than always having to go to the toilet. But I know it's easier said than done with my dear mum. Mum, please drink more water.
Yeah.
Always toilet, right? And especially in the being out. I worry about too because I need to go in the clients and where I can stop and use the toilet and things like that too.
I'll show you the blades. So we teach blades course as well.
That's
So that's different than
always
RockTape, or is it part of it?
We can't remember what the course is called. No, I haven't run one in Canberra this year, but it's definitely in Sydney.
Yeah.
So it's more of a tools course, but I don't know what it's called. So we use blades, and we use the pods, and we use massage guns. We show you how to use all those properly.
So target on what kind of people more for that?
What kind of
Yeah,
for people injured or?
Yeah, injured or sports.
Yeah. So
young people.
if you think of it like this, so again, we talked about what massage does, right? I'll say, from my perspective, I'm applying input into the skin with my hands.
Yeah.
So people respond differently to the amount of pressure I push, and that's the only thing I can change. I can change the surface area, I can change the pressure, or whatever. I can get digit. That's pretty much all I can do, and then waiting for the person to respond to that. Okay, so we can use tape. That's another sensation. We can use heat. We can use cold. We can use pods. We can use cups as a different thing. So this is just a different feeling. It's just a different
So
sensation.
that's like the schwaga.
Yeah. Which is, it's a tool.
It's a limp.
No, it's just, it's just a tool.
It's just a
Okay.
tool.
So it's providing different sensation, right?
Yeah, okay.
So instead of my hand doing this or whatever,
Yeah.
it's a piece of steel.
Yeah.
So the brain will respond differently
Yeah.
to this. So I can go like that. This is why it's got all the hooks in it.
Oh,
things in it.
nice.
So,
Yeah.
I can get into little places here.
Yeah.
I can change the velocity. So I can't do that with my hand.
No.
So I'm providing different velocity to the receptors in the skin, and the brain will respond to that again.
Yeah.
So I'm not breaking down tissue. You will get a redding, a red effect. If you do it for too long, you may break some capillaries, like a cup, like a pod.
Yeah.
But basically, it's providing stimulus,
Yeah.
a different stimulus,
Yeah.
other than your hand.
Yeah.
A bit of a hand saver too. So if your hands get sore, you can use this.
Yeah.
So you can just use something different. So the person's brain will respond different to this. So that, and that's why we've got these for that.
Cool. I love
That's
that.
called
This is also RockTape as well. Though.
they're rock blades. Yeah,
Rock blades.
It's called a mohawk.
Is any other different type? Shape type?
Sorry.
Or this is the main shape?
Oh, I'll show you in a minute. So again, different sensations. So we can put that in the phone sleeve. So this is more of a rubber effect, or we can use the comb.
It's got a.
So neurologically, you can use a comb.
It's got fashion.
Yeah.
More.
Stimulus, different stimulus.
That's
It's all stimulus. It's
awesome.
just different. Yeah.
Who came up with this?
Smart people.
Smart people.
Yeah, so it's a comb, so it's a different stimulus as well.
Yeah.
So in your question, is it for sports people?
Yeah.
No, it's for everyone.
For everyone.
Yeah, it's just different stimulus.
Yeah. Because I've got a client. So he fell over. So then he had titanium. His whole not shoulder, elbow. Then he had to take the titanium out. And so, like he comes every week just to have time out on his body, but I'll always do his arm as well.
Yeah.
And then I'm always like, well, what more can I do? And I'm just like, because it's, he can't open it, and of course there's a lot of scar tissue. But I know, like working in here, and I keep saying, why don't you go and see like a sports physio? But
There's probably not a great deal of change. It's probably how the arm is.
But I keep thinking, what else can I do? But this.
So there is a thing called brush therapy. People actually use brushes on people.
They do,
sensation.
yeah.
No.
And then I use brush for my lymph before the shower.
So
and it's great. Lymph and
it stimulates the receptors in your skin. That stimulates your brain.
Yeah. Sorry, do you want to have a play with that? That's interesting.
And that's the iPhone case as well.
So with the silicons,
to
be a pain in the butt. That's like a whole.
Yeah, just feels that.
Yeah.
Yeah. You can just use your phone if you wanted to.
You could. The phone probably costs more, so you just whack that in there.
I don't use them very often, so they're probably a bit stiff to get in and out. Pretty good. Yep.
And then,
So again, it's probably more grip with that. I'd say it's probably stick and work maybe. Stick
That's pretty cool, isn't it?
Yeah, and you can quickly interchange them, obviously.
Use wax and
That would be so good for like
Yep.
some of my clients with the lower back and the hip.
Yep.
Here. Oh, another.
Yeah. So this is the first one we came up with made.
Oh my god. Let's do a course next year.
Yeah.
Let's go.
So this is heavier, and you can feel that one. It's a little bit greasy in the wash. And then we came up with a plastic one. The problem with the plastic one, it's actually harder to make than a steel one, because you have two pieces of plastic stuck together. So we made the steel.
Oh yeah, that is.
So that.
So then with this, you've got.
I like that. Probably like that. I probably use that one and this one the most. Yeah, that's nice and light.
oh, okay.
Yeah.
And that would be good for you.
That was.
And that's just the plastic version of it.
Oh,
That would be good back here.
Yeah, you get the big muscles. Yeah. Yeah.
Glutes.
do you use these kind of long one?
No.
This good enough,
Yeah,
right?
that'd be good. Yeah.
Yeah.
We don't make them, but
Wow.
yeah.
And you could get back
Yeah,
here.
get into this kind of, right on the edge and get in there. With, it's quite nice for people. And then flushing through there.
Yeah.
Yeah, so that's quite nice.
Yeah. That feels pretty good.
Yeah.
Especially for all that. Oh. And I suppose you could all. Glasses. Probably more that one.
It's quite
Where you
light,
could
yeah.
probably.
You could do that, yeah. This is the last one that was made.
That's really good for the neck.
Yeah, it's nice, isn't it?
Yeah, that's really
just
good.
to flush through there. Yeah,
Because
you
that
just
all
gotta.
gets really.
Yeah,
That's.
you gotta be careful.
With your client, you could just
that's
be
true.
like, you could just be, let's just work
But
on
good,
that.
You know,
Whilst you got their head.
Yeah.
quite good.
Try this one. This
Yeah.
is easy to hold when you're doing the neck. It's just that. If you dig the big section through, you can hold it different ways. Yeah, it's a nice weight that one.
And that way.
The Michael.
That's actually really good. And up here in the neck.
Yeah, pinpoint. And you've got this little thing here as well.
Yep.
You can use that. What would you use that for?
How you do?
Open a beer?
Yeah, correct. It's a bowl opener. End of the day. Had enough of these
Had
people.
a hard day's work. Let's have a beer.
That's a part of the
That is
therapy,
good.
right?
That is what my husband would say. Surely that must be to open a beer.
Yeah,
Feel
yes.
good.
Yes.
This is
Indeed.
awesome for your neck.
Indeed. Yeah.
I am super.
Again, it's another tool, so you got to have them on hand. You just have them there. You just grab them. Just work a bit differently.
Yeah.
So you're mainly using your hands.
Because you can
or whatever.
pull, I mean, you can do more than your hand can do.
Yeah, it's
Yes.
it's a different feel.
Yeah.
It's a different stimulus.
That's so good.
So
'cause
if they get the
I would
course,
release
Yeah.
that stuff.
once done, some of the for first aid kind of has to keep going and updating.
Yeah.
It's you guys the same or
No, not
once
really. Once you
done?
learn,
Once
you
you're done.
Yeah,
develop
once
your
done.
own. You develop your own technique.
Yeah.
There's no certification
Yeah.
and stuff. You
Okay.
can anybody can use tools.
Yeah.
You're not gonna insurance wise, it doesn't matter. You're not gonna.
Well, this will go
Yeah.
into your massage insurance.
It's more
Yeah.
Yeah.
But I mean, you're not gonna damage anyone.
Yeah,
Unless
true.
you-
Even the massage, isn't it? It's
Yeah.
mostly I hear when we walk and when we move more than that we do massage. It's a muscle moving more than
Yeah.
we do.
Yeah.
But
Yeah.
it's can be quite targeted, and then
Yeah.
especially in so vulnerable people, and then so I normally go
Yeah.
and then just like my gosh, sort of.
That's awesome.
Yeah, many people got surgery after that. You
Yeah.
know, can't heal
That's right.
more than a year, and then chronic pain.
Yeah.
Thank you. I love that.
Yeah.
No worries, thank you.
And this is the one that's in Sydney, is it?
Yeah, we do them in
This
Canberra.
one. Yeah.
We advertise it, and then if we get enough people, we'll run them.
How does it work if it's some, the course, it's 2 people, book in, but not enough?
Yeah.
And then,
Bring a friend.
Yeah.
Come on.
We normally
if
people.
You
some
can stop taping.
next couple later,
Yeah.
and then, a few more, and then you guys contact the people, miss out the last time, or...
Yeah. If it doesn't, we take your money.
Yeah.
I don't take your money, but we take your money, and then the course is being run, and then it's like, oh, okay, we haven't got enough people, so we refund you the money,
Okay.
or we say, well, we can put it to, there's a course in Sydney, do you want to do it there? We'll just put it towards that one,
Okay.
or
And is it
full
over-
refund.
Is it over 1 day or 2 days?
So it's 1 day.
1
Yeah,
day.
it's over 1 day.
Pretty much full day.
Yes,
Yeah.
the tools one is a full day.
Oh, okay.
So the
I
tape
bet.
one, the tape one now is only 4 hours
Okay.
because you do an online component, and then we just get in there and we just tape for 4 hours, and then because we used to do a whole 8 hours and it was just too much
Yeah.
for people.
Yeah.
So we just get in there, we tape for 4 hours, which by the end of 4 hours you're sick of tape.
Yeah.
'Cause
Yeah.
you tape everything.
Yeah.
Is there anyone has to have any certainly knowledge?
No.
No? Doesn't matter?
No.
If I come, my friends
Yeah.
who doesn't do anything,
Yeah.
just like a...
It's better when you don't have preconceived knowledge of something.
yeah. Sometimes too much, isn't it?
No. Yeah, we got everybody. When I used to run them 10 years ago, we get everybody doing. We get physios, we get massage therapists, we get chiropractors, we get podiatrists, we get sports trainers, we get someone who works in a chemist who needs to learn how to show people how to do it.
Just a
matter.
mom, and then
Yeah.
someone's mom, and
Yeah.
I thought you
kids.
might need to be a
or-
massage therapist. I don't know why, but that's
No.
good to know.
Anybody can tape.
Yeah.
Yeah. I mean, parents who take their
Yeah,
kids.
Yeah.
That's
Yeah.
right.
So-
And then once got the kind of little bit done the course, and if I want to volunteer to do kids and whoever, it's easy, isn't it?
Yeah,
Yeah.
you can do what you want. Yeah.
It's more like paperwork wise, document wise, even volunteer sometimes.
Oh, if you're volunteering,
Sports.
yeah.
Yeah,
But
little bit like a for insurance.
Oh,
like
yeah.
a bit.
Yeah. I don't know. It depends on
Yeah.
who you don't work
Yeah,
for.
true.
Yeah. Hmm.
Still work for the ice,
Yeah.
any injured, put ice on.
Yeah. So there's a bit of debate about ice. So ice is a vasoconstrictor, so it'll constrict arteries in there and stop swelling.
Yeah.
So whether that's a good thing or not, because swelling has its
healing,
properties
isn't
of
it?
it's a
Yeah.
healing effect.
Yeah. I just
Yeah,
studied
so-
quite a bit. The funny things at AFL,
Yeah.
true or not, my daughter's got the uncle, and
Yeah.
then first aid I say, I asked, and then ice. She said no. If ice on, she's not able to go back on the field.
Yeah. It's
And
really the
it's a bit funny things, and they still work.
Yeah.
And then, but I check it,
Mm.
and then one of the physio actually article, read it. It's part of the process to healing. If put the ice on,
Yeah, because it's
It's
rest,
stop.
rice, isn't it?
and then
Yeah.
it's gonna be delayed. And then ice, it
Yeah.
doesn't really much background.
Yeah.
It's just like we passed around. It's just coming up in the popular, but it's not really much evidence. It's
Yeah. There's not much evidence that ice.
Yeah.
Is the best.
Promotes
Yeah.
healing
Mm.
or heals quicker.
I prefer myself.
Yeah.
I more like a heat
Yeah.
than a
Well,
cold.
Yeah.
The heat is healing it. Really,
Yeah.
I would say it's kind of putting it back into stress, isn't
Yeah.
it? When we're cold, we're in stress phase,
Yeah.
aren't we?
Yeah.
If we look at what is it, better health, it brings the body back into stress and cold. So the heat is what's healing the actual body, isn't it?
Yeah. I mean, body's pretty good at healing itself
It's amazing,
generally.
isn't it? Yeah.
So can you accelerate that? I don't know. So mainly they use ice. So sporting teams, I do work with the Raiders as well. So they'll still use ice if someone does their ankle. They'll still use ice, and all sporting teams will. But it's probably more for pain relief as well. Ice will give you pain relief.
It will,
Just like a little bit, and that's all.
And look, I don't think it'll delay healing that much. No. But I mean, the players will also they'll use I can't remember. You can buy them from Aldi as well, where they fill a bucket up with ice, and they have pumps, and they'll put a knee guard on, and it'll pump cold water through that for 2 hours.
Yeah.
So it'll be compression and cold.
Yeah.
So they'll do that as well for swelling and injury as well. So that's really common. I can't remember the name of it, but the expensive system, and it was cheaper at Aldi.
Good old Aldi.
Yeah. not as good.
I'll do it again, but we'll do it cheaper.
Yeah, so they'll still use cold.
Yeah.
But for swelling, for me, I'd probably try and get a bit of a jellyfish on there.
Yeah, that's why I just
movement,
forgot
jellyfish
about
and movement, just to flush that through and get more.
It isn't also elevating it so it's a bit higher, because that's really
that'll
good
flush as well. But again, the lymph pump is through movement. As well. But it depends if you can. Yeah, and then if there's ripped, really broken tendons, you've got to isolate that, immobilize that for those to heal.
Yeah.
If the injury happens and starts swelling, and then just jellyfish done. That's
so. What's jellyfish?
Probably,
This.
That's actually quite good to go.
Yeah,
right?
that's where we're trying to move and flush fluid through. Maintain movement. That'll decrease pain as well. So just like doing the knee application I put on, I use that for pain as well, just to decrease pain.
So my father-in-law at the moment, his legs are pooling.
Yeah.
I think because he's on a diuretic tablet, I think.
Yeah.
Low-lying prostate cancer, but he's having problems with it all pooling.
Yeah.
And so actually this, making sure he elevates and pumping his feet would be really good for him.
I mean, you put it on and to see how it goes. And then you have to reapply it, sort of 4 or 5 days later. That's the problem. You keep reapplying it. But it might decrease pain a little bit. If you've got pain there, it might flush through. Might flush through a little bit quicker.
Okay.
Yeah, definitely.
Okay. Awesome. Dan, you're the man.
Yeah. See, a bit of info. Yeah, good fun. Pity the other people missed out, huh?
Oh yeah.
Very good.
There you go.
I'm lucky.
Very good.
It's possible to get. Oh, thank you.
Yeah.
Oh,
I know.
woo.
Can we get
Yep.
Thanks so much, Dan.
That's all right.
I'm
It's
intrigued.
possible to get the
Recording?
coffee?
Yeah. I'll maybe whack it up on YouTube.
Yeah.
Well, I've got your email. I can send you the link.
Okay.
Yeah.
Do I have your email? Will it be given to me by the people? The powers that be in my name?
How long have you been
Massaging? Since I was 25. So I'm 56 now. So a little while. Yeah. But I learned back in Bath. So I'm originally from England, you see.
Oh, cool.
Yeah. It's taken me